morning to all. So I am here for teaching regarding the nanodrug delivery system, which will come in the semester of the 7th week Pharm. So what will be the basics of the nanodrug delivery systems? If I am saying that earlier there are several conventional dosage forms are delivered in terms of, if I am saying that, tablets, in terms of capsules, in terms of suspensions, in terms of emulsions. There are the lots of nanocarriers which are delivered as previously for the treatment of particular diseases. So bypass the first pass metabolism and target site specific, we can use the nanodrug delivery system for the particular treatment of particular target, the particular sites for the any type of diseases. If I am saying that there are the several nanocarriers which are widely used in the preparations in the treatment of the diseases. First, if I am saying that first one nanoparticles, another one is liposomes, then niosomes, then micelles, then nano emulsions, and lots of other. Basically, there are the types of the several categories and the types of the nanocarriers for the treatments for the diseases. If I am saying that there are the basics parameters for because of the bypassing the first pass metabolism for the target site specific and treatment of the disease. We can use the nano carriers for that. Basically, there are wide range for the treatment purpose or the nano carriers for the delivery the target site with the usings of the several. There are compositions where there are several methods of preparation. There are the ultimately the large numbers of the method of preparation basically used. For here, I am explaining the one of example, thin film hydration. Thin film hydration method for the preparations of the niosomes. So, in this we can firstly prepare. The thin film on the RBF, in which firstly we will carry about their compositions, basically the non-ionic surfactants, then charged molecules, then cholesterol, others also used for the preparations. So here firstly we will prepare the thin film on the wall of the RBF with the using of the several their compositions, non-ionic surfactant, cholesterol, then charged molecules, which basically the SC, the DSC, and these here diacetyl phosphates, then lots of compositions used for the preparation. And after that we will use rotary flask evaporator, or especially we can use as a handshaking also. And with the use of that instruments or with the use of the rotary flask evaporator, the thin film on the wall of the rotary RPF is prepared. After that we can use a petri dish which mainly consists of the PVS 7.4, 6.8 on the basis of the particular targeting. Then we will transfer the drug molecules. Basically, if I am saying the hydrophilic or hydrophobic, both type of drug carrier, basically they are encapsulated on the structure of the niosomes. Then after the preparations of the film, then basically the another phase is drug which will be encapsulated with the PVS over 7.4 and 6.8. After that, if we are using an evaporator, evaporation will cover with the using of the temperature 7 to 85 degrees Celsius. And with the last of the process we can use the phase evaporation or as well as phase inversion method. The final Niosomes prepared. The final Niosomes prepared, they are basically the basic and conventional method for the preparations of the Niosome. Thin film hydration, it is also known as the head shaking, it is also under the vacuum. There are several methods also for the preparations of formulations of the Niosome. Another one is ether injection, then rotary evaporations, then solvent evaporation. There are the multiple types of the method of preparations for the particular target inside. Then we are using for the pH gradient method also for the preparations, and widely we are using for the preparations of the Niosomes. First one ether injections, and then one head shaking automatic method, or basically we are using as the head shaking method also. They are basically the few of the parameters or the few of the procedures for the final preparations. If I am saying that what are the basic applications for the particular targeting nanocarriers. So at the current scenario, Niosomes are widely used for the treatment, basically the TB, the world second most killing disease. They are widely used for the treatment of the TB. Then another one we are using for the neurological disorders. Neurological disorders also used for the treatment with the using of the Niosomes and using of the other nanocarriers. Then and the last one we can go for the cancer treatment also with their incorporations. With their incorporations of the Niosome, we are widely treated the disease throughout the spread of the global world diseases, and also basically we have, if I am saying that the cancer is the one of first most killing disease, then we are also bypassing or also treatment for the TB, which will be a second most killing disease, neurological disorder, myocardial infarctions, multiple sclerosis, and there are lots of the several methods or several nanocarriers used widely for the treatment of the tuberculosis.